Social distancing is a current global precaution to avoid the spread of COVID-19. However, many people in Malaysia are not keeping their distance when they have got masks on. Dr. Chee Hui Yee, an expert on infectious diseases, is giving her advice in our following report.
COVID-19 is still going strong in all parts of the world, and each country has their own precaution guidelines, including the one that the World Health Organization has recommended, which is to keep at least 1 meter of social distancing. However, in different countries, social distancing takes on different distances.
Different countries have different social distancing safety measures because it takes into account the country's environment, like temperature. If it's a hot climate, then when droplets come out, it evaporates quickly, so it's smaller, and with the added air circulating, then the respiratory droplets will fly elsewhere. So when you speak face-to-face with another person, they're less likely to be affected by your droplets.
Malaysia government has set the standard that in public forums, people must keep at least 1 meter between one another. To this standard, Dr. Chee Hui Yee explains that to further prevent the spread of the virus, it is best to keep at least 2 meters from the next person.
If you ask me, I'll keep myself over 1 meter away from another person. In research, of course, increased safety measures is 2 meters, and that lessens your infection rate to 0.1% or even 0.001%.
Since June 10th, Malaysia has enacted the Recovery Movement Control Order, and most economic-related operations are back in business, while abiding to the necessary prevention SOP. With life seemingly back to normal, it seems people are getting careless in their prevention routine. While remembering to wear a mask, they often forget to keep their social distance.
If you wear the medical mask, there's still air vents and holes on the side, so if a person talks, the air from them can still escape from the air vents on the side, if they're standing next to you less than 1 meter away. For fabric masks, it is not able to filter the virus, so if you're wearing a fabric mask, it's best to keep your distance to 2 meters.
Being out in public, sometimes it is hard to keep one social distance from another. The WHO suggests minimal going outside, and each time grocery purchases should be enough for a week's worth, and to reduce physical contact with another. Also, Dr. Chee shares on how to avoid the virus in an enclosed space such as the elevator.
In the elevator, which has corners drawn up, if I go in and I pick out spots closest to the door and facing the elevator doors, and if someone behind me coughs, and then when the elevator door opens, the wind will circulate and helps to decrease infection rate. It's best not to talk inside the elevator. Mainly, I want to tell everyone that you should keep in mind to keep your distance from people. Even if others don't keep to social distance, you should do so for your own safety.
To prevent the spread of the virus, protection starts with you and me. As with our increased awareness and participation, can we successfully flatten the curve?